USA seems to be in the midst of a crisis with respect to essential drugs again. This problem had cropped up a few years back when COVID-19 was at its peak in the country. This time too, this crisis has a similarity with the earlier shortage. The shortage is of a prime drug that is used to treat patients with respiratory ailments such as asthma, chronic bronchitis, etc. And to make it worse, one of the major suppliers of this particular medicine has shut down. In this video, we take a look at Albuterol, the drug in question whose short supply has doctors and patients worried, and we will also explain how this critical issue might pan out in the coming days. But before that, don't forget to like, share and subscribe to Oneindia. The name of the medicine whose very short supply has become a concern now is Albuterol. It is a medication that keeps the lung passageways open and helps treat people when they experience acute shortness of breath. It is used for asthma, chronic obstructive pulmonary diseases, chronic bronchitis, acute pneumonia and acute COVID-19 infections. In all of these health conditions, the airways become narrow, making it increasingly difficult for patients to breathe. So, what this drug essentially does is that it simply opens up the airways for greater passage of oxygen. It can be used as an inhaler or as an aerosolized nebulizer. Liquid albuterol is used by hospitals for nebulizers, the devices that turns a liquid medicine into a mist to be inhaled. But now Akorn, a supplier of albuterol, has shut down its US operations, which include manufacturing facilities in Illinois, New Jersey and New York. It had earlier stopped shipping out the 20 milliliter bottles of it. Akorn was an important supplier to children's hospitals across the whole of the United States, but it was struggling with bankruptcy for 2 years and was facing enforcement actions from the FDA. The Illinois factory manufactured liquid albuterol, and its shutdown will only add to the shortage. And to add to all of these, there is only one remaining domestic supplier of liquid albuterol in the United States now, and that is Nephron Pharmaceuticals, which was taking back orders, but it has also been pulled up by FDA for violations. It started supplying drugs in late February, and getting back on track is an uphill task for the organization. Liquid albuterol is used in treating children with RSV and asthma who show up in emergency rooms, and albuterol is among the top 10 most commonly prescribed medications in the USA. Its shortage is especially worrying because it saves lives and allows people to breathe, especially when children, the elderly and also the very sick cannot really use an inhaler. There has been a shortage of supply of generic drugs across the US for months now, and albuterol has been on the FDA shortage list since last October. Generic drugs are priced lower than their brand name counterparts, which makes them less profitable for drug makers. This also means that they have fewer manufacturers, which makes them susceptible to shortages if one producer fails or shuts. And this is what will happen after the closure of the Illinois factory of Akorn. Hospitals have been dealing with an overload of cases of RSV, flu and COVID-19. This means that more patients need this drug, but the supplies will not be able to cope up with the increasing demand. The problem is worrisome because the allergy season is around the corner in the United States. The transition from winter to spring leads to a rise in respiratory illnesses like RSV and flu. With the onset of spring, around 20 million adults and 5 million children with asthma will be facing potential issues. At the moment, hospitals are looking for alternatives and using the drug judiciously. They are asking patients with breathing problems to be cautious and to avoid triggers. For now, inhalers are not impacted, but if people panic about the lack of albuterol in hospitals, that could possibly change for worse. So, the problem that has been haunting since October might become very bad in coming weeks or months, and children and infirm elderlies will be the most vulnerable to it. We hope you would like this new video. Thank you so much for watching.
Subscribe to Oneindia channel and never miss an update.